Okay, let's get into talking about, I want to talk about some medical issues. I'm sick and tired of the fight between alternative, so-called more natural methods and conventional medication. It's just ridiculous. I use both. I take a conventional antidepressant. It's an old one that was invented before Prozac came on the market. I'm also doing some diet stuff. I'm taking some probiotics, which is one of the natural things, and I'm doing diet stuff to control my yeast infections, so I'm using both. Sensible use of both. Now, my bias is in little kids, real little kids, like 3- and 5-year-olds, I want to avoid the heavy-duty conventional drugs if possible. Of all the biological treatments, I think everybody ought to try the diets on little kids. They don't work on everybody, but they work really well on about 1 out of 5. It's definitely worth trying. Casein in the gluten-free and wheat-free, and then specific carbohydrates, sort of an Atkins-like diet. You can sometimes put the dairy back in as cheese and yogurt, and you cut out tons and tons of sugar and high glycemic carbs. And I've found that, people say it needs to be organic and all of this. Yeah, that's nice, but it doesn't work when I'm traveling. And regular stuff seems to work just fine for me. And then my probiotics, I have to be very careful not to leave my bag in the car and let them get hot, because that will destroy the probiotics. But, let's do things like diets are definitely worth trying. Some of the vitamins are definitely worth trying. Now, the other thing you want to do is try one thing at a time. Don't be taking 10,000 jillion things. Try one thing at a time and see what works. You want to take the few things that work. Okay, evidence of effectiveness. Of course, the best evidence is properly done scientific studies. But we don't have that for a lot of things. And one of the problems is getting funding. You see, like, I've been on my medication for over 25 years. Can I get off my medication? I don't know. I've seen disasters when people that were stable went off their medication. There is no research to guide me. Nobody funds that research. And a lot of the drug companies fund research, and they fund little 6-week studies, to show that their drug was better than placebo. And the drugs that have the weight gain side effect, well, that's not going to show up in a 6-week study. A lot of the research that should be done isn't getting funded. But the other thing is, autism is not a precise diagnosis. So let's say I'm going to go study a diet, and there is starting to get to be some research showing that diets do work for some people. How do you separate the responders out from the non-responders? Well, now there's powerful statistical methods you can use to pick out that there's a subgroup in responding to diets, but it's definitely worth trying. And if a diet doesn't work after 3 months, then just get rid of it. If it doesn't work in 3 months, it's not going to work. And usually you'll get some benefits in a month, but 3 months is plenty of time to try it. Okay, let's get in and talk about some of the regular medications. I like to use a military analogy. You've got the light weapons, and you've got the heavy artillery. Now, these are the SSRIs, serotonin selective reuptake inhibitors, your antidepressants. These are the drugs that I want to rename the anti-stress drugs, because there's a lot of research saying, they don't really work for depression. Well, what they work for, man, is anxiety. These are light weapons. These have a lot less side effects than the drugs I'm going to show on the next slide. Prozac's the original one, and it's a very, very good drug. If you're going to just, and Prozac and Zoloft are both cheap generics now in the US. And if I was just going to grab one off the shelf, pick it off the shelf at random, probably be Prozac or Zoloft. Cheap generics that work really well. Zoloft came out really well on a big meta-analysis that was done. I get 4 doctors' psychiatric newsletters. They're really expensive newsletters. They're really good, like the Brown University newsletter. And they really take the drug companies to task on some of the stuff they've done. But those are 2 really good first choices. Lexapro's getting really good reviews. Paxil's had the most problems. Now, the thing is, drug companies will do things to extend patents on drugs. They're only interested in selling drugs that are patented, because they make a lot of money on patented drugs. Once they go generic, they don't make any money on them anymore. Well, Paxil, they made an extended version. I just call it a patent extender. And so they're pushing Paxil. But I've been hearing too many memory problems with Paxil. And there has been a lot of controversy about some of the research, and it's been associated with more problems. Now, the thing is, there's people taking Paxil, and it's working really, really well for you. If it's working fabulous for you, you stay with it. But it wouldn't be the one that you'd want to pick off the shelf first because of the complaints about memory problems. Prozac and Zoloft, I know lots of people taking that. Lots of designers take Prozac, and there's been no problem with being able to do their work. You know, their mind is working just fine, and I put a very high priority on that. Now, one of the things about these medications, tiny doses. The mistake made with these meds is giving too high a dose. And the doses in the physician's desk reference are often too high for people on the spectrum. Now, if you give too high a dose, the first thing you'll see is they cannot sleep. And then they're going to feel like they drank 10,000 cups of coffee. Now, with Prozac, since it metabolizes very slowly, you can sometimes get this overdose effect maybe 2 to 3 weeks after you start it. And then what you do if that happens, you just cut back the dose. Or you go off it for a little while. It metabolizes slowly. You know, the other drugs, you'd see it quicker. But the mistake that I've seen hundreds of, this I've had 100 parents tell me, he did wonderful on a small dose, we doubled the dose, and it was horrible. And then they get afraid of the drug. In tiny doses. This is explained in detail in Thinking in Pictures. I updated the medical section in 2006 in Thinking in Pictures. Other thing about Prozac, that's a very interesting drug. It makes neurons grow in the hippocampus. The hippocampus is your brain's file finder. It's being experimented with right now as a treatment for Alzheimer's. Prozac is the granddaddy of all the SSRIs. It's a really good drug, but you just have to understand that it's a slow metabolizer, and you can sometimes get the overdose problem 2 weeks, 3 weeks after you go on it. And then you can just go off it for 3 or 4 days and start up again at a lower dose. If you skip a dose of Prozac, it causes, that usually doesn't hurt you. Zoloft, you got to make sure you take it every day. You skip a dose, it's not good. But Prozac, Zoloft, Lexapro, Lexapro's still patented, so it's kind of expensive. But Prozac and Zoloft, nice and cheap now. Okay, here's the heavy artillery. Now, most of this heavy artillery is still patented. So they're pushing this. I mean, I was on the plane yesterday, and this little teenage girl was sitting beside me, having a little teenage girly magazine, and there was an ad in there for Abilify. I thought I was going to throw up. Sometimes there's a need for heavy artillery, but these are getting pushed for a lot of things that really shouldn't be pushed for. Risperidol is off patent now, but you have some bad side effects here, like weight gain. Sometimes really excessive weight gain, diabetic, getting diabetes, things like this, problems like this, serious side effects. Also, you can get the tardive dyskinesia, the shaking and nerve damage disorder. Now, sometimes you need heavy artillery, but it's not the first thing that you ought to be going for. Zyprexa is actually a very effective drug for schizophrenia, one of the most effective, but it has the worst problem with weight gain. One of the things that's unfortunate is that when they take out the side effects, sometimes you take out some of the main effect. Now, where Risperidol really has research backing is for controlling aggression. Okay, let's say you got an older child. Now, if there are people giving it to 5-year-olds, I think that's a no-no. But you get an older child, like 10 years and up, a lot of aggression problems, especially some of the more severe ones. Some of these very severe nonverbal or partially verbal cases, little tiny bit of Risperidol, very tiny dose. Stop that aggression. And that's very, very well documented. And then you've got to make sure you don't let them get fat on the stuff. Risperidol is, probably be the one to use. Also, Risperidol can help on sound sensitivity in a little homeopathic dose. Donna Williams can now do convention center. She takes 1/4 milligram a day of Risperidol, 1/4 milligram per day, and it works for her sound sensitivity. So that's, sometimes you need to use a little heavy artillery, but you want to use it very sparingly and very, very carefully. Okay, the low-dose principle applies to 3 classes of drugs. The Prozac family, the SSRIs, tricyclics, those are the old-fashioned antidepressants, and then these atypical lists that I just showed you. Sometimes people on the spectrum need 1/4 to 1/2 the starter dose, and that's all they need.